If you suffer from migraines, then Celecoxib 120 mg per 4.8 ml, 25 mg per milliliter, oral solution might be able to help. This medication is used to relieve headache, pain, and other migraine symptoms such as nausea and sensitivity to light and sound. By taking this medication promptly, it can help you get back to your normal routine and may even reduce your need for other pain medications. Celecoxib is a type of nonsteroidal anti-inflammatory drug, NSAID, specifically a COX-2 inhibitor. It works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. It's best to follow the recommended dosage and take this medication at the optimal time for maximum benefit. Before we begin, it's important to always read the medication guide and instructions for use provided by your pharmacist before starting to use Celecoxib. Take this medication by mouth with or without food as directed by your doctor, at the first sign of a migraine. The dosage is based on your medical condition. Take this medication only when needed and do not take more than one dose in a 24-hour period. This medication comes in a bottle and the amount of medication in the bottle is usually used for one dose. If instructed to take all the medication in the bottle, drink the medication directly from the bottle. If instructed to only use half the amount of medication per dose, carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. After taking the medication, you may drink up to a full glass of water, 8 ounces or 240 milliliters, unless your doctor directs you otherwise. If you are using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Medication overuse headache. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. If you experience changes in your sense of taste, it's important to let your doctor or pharmacist know. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. It's common for people using this medication to not experience any serious side effects. However, it's important to monitor your blood pressure regularly and notify your doctor if it becomes elevated. Seek immediate medical attention if you experience any severe headache, pain or swelling in your groin or calf, signs of kidney problems, difficulty or pain when swallowing, or symptoms of heart failure. Additionally, if you notice symptoms of liver damage, such as nausea, vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine, it's important to seek medical help right away. While it's rare, a serious allergic reaction to this drug can occur. If you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And as always, if you have any concerns about the medication, don't hesitate to reach out to your healthcare provider. Taking Celecoxib oral solution may rarely increase the risk of heart attack or stroke, especially if taken for a long time. This risk may be greater in older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. Do not take this medication right before or after heart bypass surgery. Additionally, this medication may rarely cause serious bleeding from the stomach or intestines, which can occur without warning symptoms. Older adults may be at higher risk for this effect. If you experience stomach/abdominal pain, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, stop taking Celecoxib and seek medical help right away. It's important to talk to your doctor or pharmacist about the benefits and risks of taking this medication. Be sure to follow the recommended dosage and take it at the same time each day. Before taking Celecoxib oral solution, it's important to talk to your doctor or pharmacist if you have any allergies to aspirin, other NSAIDs, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. You should also discuss your medical history with your doctor or pharmacist, especially if you have asthma, blood disorders, growths in the nose, liver disease, stomach/intestine/esophagus problems, heart disease, high blood pressure, or kidney problems. It's important to stay hydrated while taking this medication and to report any unusual changes in the amount of urine to your doctor. Additionally, be cautious about combining alcohol and tobacco with this medication, as it may increase the risk of stomach bleeding. It's important to limit alcohol consumption and stop smoking while taking Celecoxib oral solution. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For women of childbearing age, it's important to discuss the benefits and risks of using this medication with your doctor. If you are pregnant or planning to become pregnant, this medication may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor determines that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. Additionally, it's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions with Celecoxib 120 mg per 4.8 ml, 25 mg per milliliter, oral solution, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this medication include aliskiren, ACE inhibitors, angiotensin II receptor blockers, sitafover, lithium, and water pills, diuretics. It's also important to note that this medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Celecoxib and may increase the risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking it unless your doctor instructs you otherwise. Be sure to ask your doctor or pharmacist for more details. If someone has taken too much Celecoxib oral solution and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of overdose may include severe stomach pain, slow or shallow breathing, or loss of consciousness. It's crucial to act quickly and seek medical assistance if you suspect an overdose. It's important not to share this medication with others. Certain foods, beverages, or food additives, as well as lifestyle patterns such as irregular eating/sleeping habits or stress, may trigger a migraine headache. Avoiding these triggers may help lessen migraine attacks. It's best to consult your doctor for more details on managing your migraines. Your doctor may recommend lab and/or medical tests, such as blood pressure, complete blood count, and liver/kidney function tests, while you are using this medication. It's important to keep all medical and lab appointments. Make sure to consult your doctor for more details on what to expect while taking this medication. In this video, we're going to talk about the uses of Celecoxib 120 mg per 4.8 ml, 25 mg per milliliter, oral solution. This medication is used to treat arthritis, acute pain, and menstrual pain. It helps reduce pain, swelling, and joint stiffness. The usual dosage for adults is 200 mg once daily or 100 mg twice daily. It's best to take this medication with food to help prevent stomach upset. Remember to take it at the same time each day. If you have any concerns about taking this medication, be sure to talk to your healthcare provider. When it comes to storing Celecoxib 120 mg per 4.8 ml, 25 mg per milliliter, oral solution, it's important to keep it at room temperature and avoid refrigerating or freezing it. It's also essential to store it away from children and pets to prevent any accidental ingestion. When you no longer need the medication or it has expired, make sure to properly dispose of it by consulting your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.